Marijuana isn't just being talked about in pop culture anymore. It's being prescribed, studied, and regulated inside modern medicine. But how is it actually being used in healthcare today? Let's break it down, without myths, hype, or politics. When people hear medical marijuana, they often imagine smoking a joint. But in real healthcare settings, cannabis is used in measured doses, specific formulations, and controlled delivery methods. Doctors are focused on one thing: how cannabis compounds interact with the body, especially the endocannabinoid system. Pain management. One of the most common medical uses of cannabis today is chronic pain. Medical cannabis is used for nerve pain, arthritis, multiple sclerosis, chronic inflammation. In many cases, it's used as an alternative to opioids, helping patients manage pain with fewer risks of dependency. Doctors often prescribe balanced THC and CBD formulas, or low THC options, to control pain without heavy intoxication. Neurological conditions. Cannabis has some of its strongest medical evidence in neurological disorders. CBD-based medications are used to treat severe epilepsy, treatment-resistant seizure disorders. These are FDA-approved cannabis-derived medicines prescribed in clinical settings, not dispensary products. This marked a turning point where cannabis officially entered modern medicine. Cancer support and chemotherapy. In oncology care, cannabis is used to help manage nausea and vomiting from chemotherapy, loss of appetite, pain and sleep disruption. Hospitals sometimes prescribe synthetic THC medications to help patients maintain strength and comfort during treatment. This isn't about curing cancer, it's about quality of life. Mental health and sleep. In carefully controlled cases, cannabis compounds are used to support PTSD symptoms, anxiety disorders, mostly CBD, not high THC, sleep disturbances. Important note: high THC cannabis can worsen anxiety or psychosis in some individuals, which is why medical use emphasizes low doses and supervision. Inflammation and immune response. Cannabis interacts directly with the endocannabinoid system, a system involved in immune regulation, inflammation, pain signaling. Because of this, cannabis is being studied and used for Crohn's disease, fibromyalgia, autoimmune conditions. Research is still ongoing, but results are promising in symptom relief. Palliative and hospice care. In palliative care, the goal isn't cure, it's comfort. Medical cannabis is used to ease pain, improve sleep, reduce anxiety, increase appetite. Here, cannabis is seen as a compassionate tool, not a recreational substance. How it's actually given. In medical settings, cannabis is rarely smoked. Instead, it's delivered as oils and tinctures, capsules, sublingual sprays, topical creams, controlled vaporization. This allows consistent dosing and safety monitoring. The medical shift. Institutions like the Food and Drug Administration have approved cannabis-derived medications. Medical schools now teach the endocannabinoid system. Research funding continues to grow. Cannabis is moving from counterculture into clinical medicine. Modern medicine doesn't see marijuana as a miracle cure. It sees it as a tool, used when appropriate, precise, and monitored. As research expands, cannabis is finding its place alongside conventional treatments, not replacing them, but supporting the body where it needs help most. If this helped you understand medical cannabis more clearly, like the video and subscribe. And tell me in the comments, do you want a breakdown of CBD versus THC, the endocannabinoid system, or how cannabis compares to herbal medicine? Stay curious, and I'll see you in the next one.